Breathing with ankylosing spondylitis. Have you been diagnosed with ankylosing spondylitis and you're starting to have some rib pain or have some pain in your chest when you're breathing and you're wondering what it is that you need to do about it because every time you try to move your ribs, it's really, really painful? Well, that's what we're going to talk about today. So the first thing we're going to cover is what is ankylosing spondylitis. Then we're going to talk about how it can lead to rib pain. And then, of course, we're going to finish up with what you can do about it with some really specific ideas that you may need if you're suffering with ankylosing spondylitis and you have rib pain. Now, this video was done because we posted a video regarding breathing in particular, and someone commented that they do have ankylosing spondylitis. And so I wanted to create this video for that person so that they have some more ideas to understand exactly what it is that's going on and what they can do about it. So first, ankylosing spondylitis. If you have been diagnosed, you have probably done a ton of research into it, but basically it's an inflammatory disorder that affects primarily the spine and hips. So usually for most people, it starts with like a low back pain or maybe even below that in the SI joint, which is below the low back. Or some people will experience it as difficulty moving their hips initially. What happens is from the low back, it will travel up the spine. It can go through the thoracic spine, which is your chest, and then it goes up into the neck and can even start to cause some headaches and difficulty with neck motion over time. Ankylosing spondylitis is a progressive disorder, and so it tends to start in one spot and then it will spread over time, which is why you may have been diagnosed years ago and not had rib pain, not have difficulty breathing, but now it has progressed. It's moved up the spine into the thoracic spine or into the chest. Now, the rib pain is not necessarily coming from the ankylosing spondylitis that's in the spine. So the spine doesn't actually have to move that much when we breathe, but the ribs attach right next to the spine. And they attach into those vertebrae, which are being affected by the ankylosing spondylitis, and they can also start to have an inflammatory issue. Now, that's usually if it starts in the back. However, remember that the ribs go all the way around and they connect in the front, in the sternum, most of them at least. If you start having rib pain in the front, I encourage you to contact your doctor because rib pain in the front obviously can be a sign of a heart attack or a heart issue. And even if you've been diagnosed with ankylosing spondylitis and you're pretty sure that that's where the problem's coming from, you definitely want to make sure to check it out and make sure that you're not having any other issues because we don't want to find out that we were mistreating a heart issue. That's not a good one. So if this is your first time having any rib pain with ankylosing spondylitis and it starts in the front, I highly recommend you talk to your doctor just to clear up any other medical issues. There you go. There's my disclaimer. Now we're moving on. So usually the rib pain does start in the back and it works its way around. It does have the potential to end up affecting where the ribs attach into the sternum as well. And it causes that inflammation there, which causes that pain with breathing because the ribs have to move while we're breathing. So they move in what we call kind of a bucket handle. So if you think about a bucket, how it kind of moves like this, right? That's kind of what the ribs do. It depends on where they're located. There's a little bit more nuance to it. But if you think about it that way, there's kind of a rotation that happens at the rib heads in the front as well as where they attach on the vertebrae in the back. And it's that movement at that joint that causes the pain. So people feel like I can't get a deep breath or their breath is kind of stuck up in their throat and it's very difficult to get that deep, full breath. And it can be really, really challenging and make it hard to feel like you can do exercise or anything like that. Which, if you've had ankylosing spondylitis for a while, you know that the doctor tells you to stay as active as possible because it's really important to get good blood flow, to manage your mobility, your flexibility, to help with this disease as it progresses. So it's really hard to exercise if you can't take a deep breath, which is what we're going to talk about today. What can you do about it? That's what everybody wants to know, and that's really the point of the video here today. When you have ankylosing spondylitis, especially if you have pain in your ribs, that makes it difficult to focus on that deep breathing, to get those ribs moving, to get that bucket handle moving up and down. What you want to do is go with what you can, and what you can go with is the diaphragm. The diaphragm is a huge muscle that sits at the base of the rib cage, and it's actually the one that's responsible for deep breathing. So when you're swimming, biking, running, all of those activities, you're actually supposed to be using your diaphragm. Now, a lot of people in today's society don't, whether or not you have ankylosing spondylitis. So that's why we're going to talk about this today, because if you are struggling with ankylosing spondylitis, then you really need to use that diaphragm because it's more difficult to use those joints. So yes, the ribs are going to have to move while you're taking that deep breath, but what we want to focus on is getting that breath all the way down to the diaphragm. The more the diaphragm moves, the deeper the breath is, and it will be less irritating to the ribs over time. So how do you do that? All right, so I'm going to link a video here that discusses the basics of getting that good diaphragmatic breath. Now, in this video, I'm actually lying down on my back, which may be provoking if you have ankylosing spondylitis. So stick with me for just a second here. But on that video, the reason why I like it is because you are well supported, and it's easier to focus on how to get that diaphragm moving. If it's possible for you to lie down on your back and that doesn't aggravate your ankylosing spondylitis, then that's what I recommend you start. If you feel like you are struggling still to take a deep breath, what I would recommend is lying with your arms straight up overhead. When you do this, it helps to lift the rib cage up, which makes it a little bit easier to get that oppositional force of the diaphragm. So if you're capable of laying on your back and doing the deep breathing without increased pain, but you still find it difficult to take a deep breath, then what I would recommend is raising your arms up overhead. That should help to give you a little bit more motion through that diaphragm. Now, for my friends who are struggling to be able to lie down on their back, a lot of people with ankylosing spondylitis, as it progresses, lying on their back is really, really painful. I like to have people start any breathing, no matter what they're working on your back, because it just makes it easier. It's just everything else is supported. You don't have to worry about all the other pieces, parts. If you look on the internet with ankylosing spondylitis, they will actually recommend that you do it in standing. Well, again, I feel like that's a lot of stuff to keep track of. You got the legs, you got the body, you got all these things. Plus, what if you get lightheaded from deep breathing? I really don't like that idea of standing either. So what we're going to do is we're going to compromise in the middle, and we're going to have you do it in sitting. It's the same thing that you're doing when you're lying on your back, but in general, sitting tends to be a less painful position. So I'm going to link a video here that shows you how to do it in sitting, but I do want you to realize that this is the third video in a series. So if you feel like, gosh, this is kind of a more advanced concept, you can go back and watch the first two in that series if you feel like it's hard to kind of figure everything out. This video in particular, though, shows you how to focus on that diaphragm. You put your hands right around these lower ribs. Now, I will say, if you have ankylosing spondylitis, I tell you in the video to put a little pressure here to give you something to work against. But if that's painful and that aggravates the ankylosing spondylitis, then don't do it. Just put the hands here as an awareness factor, not a pressure factor, but just oh, I'm aware of it, okay? Because we don't want to be causing any pain. If you're increasing your pain with your breathing, your body is automatically going to try to substitute the pattern and not allow you to take that deep, full breath. All right. Ankylosing spondylitis, it is more difficult to get that deep breathing, but it is even more important because we need to keep moving the body as much as possible, getting that deep breathing, keeping that flexibility, keep that blood pumping to keep you mobile, healthy, and active for as long as possible. Now, if you suffer with ankylosing spondylitis, what are some other things you can do that will not only help increase your breathing, but just decrease your pain overall throughout your rib cage? One thing you want to start working on is really focusing on your posture. And I know it is super hard if you have ankylosing spondylitis to get into that good posture because everything wants to come forward. And initially that feels better. However, over time, it's not going to. And again, we need to keep the flexibility and the mobility in the joints as much as possible. So we want to keep a good sitting posture. We want to keep head on top of shoulders, shoulders on top of hips. If you're standing, then your hips would be on top of your feet. We want to make sure that we are in this really, really good posture so that we don't have any increased tissue tension or muscle pull or anything like that, because the joint's already having enough inflammation. We don't want to add to it. Now, if you do find yourself having some inflammation, I definitely recommend ice. Ice can be used locally and it doesn't have to be used for that long. So if you're someone who just really struggles with ice, it just makes your whole body feel cold, wrap up in a really warm blanket and then take an ice pack and put it on that area that's really painful for 3 to 5 minutes. It will help to decrease the pain. It may help to allow you to do more of those breathing exercises, and getting that oxygen flowing will make you feel better. Now, I mentioned it earlier in the video, but it bears repeating. Improving the blood flow throughout your body with exercise, if it's biking, elliptical, walking, whatever is your activity of choice, cannot be underestimated. Staying as flexible, as mobile, increasing your endurance, getting that deep breathing is all super, super important. Ankylosing spondylitis is something that does have to be managed. So it's not something that, you're ever going to get rid of, but we got to keep every inch we have. It's really, really important that we not let this disease gain any ground, or we do everything we can to keep it from gaining ground. The last thing I would recommend is finding a really good manual physical therapist who is located nearby you so that they can help you keep as much mobility as possible. Now, this is a progressive disorder, and I understand that. A physical therapist, it doesn't matter how good they are, is not going to be able to cure you of ankylosing spondylitis. However, keeping those joints mobile and flexible and everything moving correctly is going to help you manage the pain as much as possible, stay active as much as possible, which is going to decrease the progression as much as possible. You want to find someone who can work with you over the years, who can help you keep track of where you are, areas that are stiffening up, make sure there's not too much stress on other areas, and help keep you as balanced as possible. They'll also be able to help you come up with a good, safe exercise program that's an appropriate tolerance for you. I have had some ankylosing spondylitis patients who really aggressively embrace the exercise, and it gets to be a little bit too much, like really long runs and things like that, that really are challenging and potentially damaging for their joints. So everybody is different. You need to find someone who you can trust, who can help you get things moving as much as possible, but also who you will listen to their opinion if they tell you that you need to balance in some rest or find some other activities that maybe aren't as pounding on those joints. So find a good manual physical therapist who can walk with you through the next couple of years to kind of help you figure out what's the best routine for you, because everybody's a little bit different, and what's going to work best for your body is going to be different than somebody else's. So find that specialist who you connect with, because you guys are going to be friends for a while. I hope this video was helpful, and I would love to hear your questions. I'm always happy to make a video to help answer them and help you live your best life. Now you can go check out this one over here.